Let's take a look at that leg.
I was rushing to my 11 o'clock on my cell phone, which I know is a horrible idea. Didn't even look before crossing the street. I mean, it's totally my bad, but still, whatever happened to pedestrians having the right of way?
That's why I take the bus. Does it hurt when I press here?
No, not much.
You don't get extra points for tolerating pain, Mr. Dietrich.
It's not bad. It just clipped me as I was jumping out of the way, really.
Well, good news is it doesn't appear to be broken, but there is fluid on your knee. I think we should have ortho take a look.
Is that really necessary? I've got to file an emergency motion before lunch.
I understand, but we can't release you without a complete workup.
I'll tell you what. I play tennis with Bernie Goldstein, chief of orthopedics over at Northwestern. If you can just brace my leg and get me on some crutches, I guarantee he'll get me in for an office visit first thing tomorrow morning.
Make your appointment, I'll check with my attending.
Great, thanks.
Mr. Dietrich, I'm Dr. Charles.
Hey.
How are you?
Good, good.
I have come to render an assist with this deceptively tricky brace.
Sure. Chief of psychiatry?
Technically, yeah. Today more like chief of physical therapy. I blew my knee out, slopes a couple years ago, got stuck with one of these suckers for a few months. The trick is the buckles.
Okay, great. Good to know. Thank you.
So, how'd you do this?
Oh, just one of those mornings, completely overbooked. Point is, I was running late.
And on your cell phone.
Right. I was on the phone with my insurance broker. Need to up our homeowners. Anyway, so I stepped out into the crossing, tried to jump out of the way, but couldn't. So, boom, I'm on the ground.
Wow. Hell of a morning.
Yeah. Well, I'm just thankful for the intrepid Miss Reese here for patching me up so I can get on with my day.
You know, you can't really drive like this, so what, should we call your wife?
No. I just mean she's really busy. Billed nearly 80 hours last week, so I don't want to bother her with something like this.
Great. Nice to meet you.
Yeah, pleasure. Thank you.
Miss Reese, could I just see you for a second? Could you do me a favor and give me a heads up before you discharge Mr. Dietrich?
Okay.
Thank you.
Thank you. Dr. Charles, good news. I'm out of here.
Before you go, could I just talk to you for a sec? Miss Reese, do you mind excusing us for just a moment? Thanks.
Yeah, I really have to go.
I will not keep you for more than a minute. I just want to understand a little better what happened this morning.
I already explained. It was an accident, and I'm sorry, but I'm really late.
I understand you're a very busy man. Listen, off-the-wall question. Have you been having a hard time getting out of bed in the morning recently?
No. I have to go. Thanks.
Mr. Dietrich?
Excuse me.
Mr. Dietrich, I'm sorry. I can't let you leave just yet.
What are you talking about?
I am not convinced that it was an accident when you stepped in front of that car this morning. I think you were trying to kill yourself.
What?
Dr. Charles?
And I'm worried that you still might be a suicide risk. And if you insist on leaving...
I do.
I'm gonna have to place you under temporary psychiatric hold.
This is ridiculous.
Well, Earl here is gonna take you someplace quiet, and hopefully we can talk.
I will sue you and this entire hospital.
Thank you, Earl.
I'll have your medical license. You can't do this.
I can't actually.
What? This?
He tried to commit suicide, Sharon. I wasn't about to let it happen again.
He's a successful lawyer with no past history of depression.
I know the type, okay? Look, the way he recounted what happened, his need to sell this way too detailed version of the narrative, right? Look at his x-ray. He took the impact directly above the knee. Directly. That means he stood in and took the brunt. He wanted to get hit.
That's conjecture, Daniel. You're usually not this quick to make a diagnosis.
With this condition, you become a master of disguise. Just give me a little more time to see if I get him to drop the mask, okay?
All right, just
Okay.
find a way to do it without further complicating my life.
I realize this is a very uncomfortable situation, really.
Do you? I don't have to talk to you.
Of course not. Hope you will.
What does it matter? I could tell you that I'm a happy man, that I have a perfect life, which I do, but you've already got your mind made up about me.
Mr. Dietrich, I don't have my mind made up about anything. I am genuinely here to help.
Help?
Yeah.
No. This is how you justify yourself. Look at you. So smug, so sure of yourself. Like you know me? You don't know me. So go ahead, tell me what my problem is.
Tell you what your problem is?
Yeah. Come on, enlighten me, Dr. Freud.
Doesn't really work that way.
Okay, wow. So you don't know, do you? This is your job and you don't have a clue. So you got all those people fooled out there, huh?
You know what? I think we are hitting a bit of a wall.
Yeah.
So
You know why? Because I shouldn't be here in the first place.
I'll check in on you later.
Okay. Yep. Hope you got your malpractice premiums paid up.
You know what? I am going to tell you why I think you threw yourself in front of that car. It's precisely because you think you have the perfect life and you're still miserable.
So what, I'm an ingrate?
It's called endogenous depression, and it's caused by your brain chemistry. And like so many people who suffer from depression, you're ashamed to tell anybody about it because you think it's your fault.
Okay. Yeah, I bet. Sure.
Okay. Look, why don't you call your wife? Tell her where you are, why you're here. She's an attorney. She'll get you out of here in 5 minutes. She knows what to do. Well, you don't want. What? You don't want to call her? Why, you worried that maybe she finds out that you're not the brave, strong man she married, she might not love you anymore? Do you know that the single greatest challenge that I face is trying to convince people that depression isn't a sign of weakness?
Okay, I'll remember that if I'm ever depressed.
Okay. You know, I gotta hand it to you. You're one hell of a performer. I mean, a real trooper. I mean, you're keeping it up for so long. You're selling this idea of who you think you need to be all the time. Carrying around the weight of that performance. Isn't it tiring? Aren't you exhausted? I think it'd be exhausting.
I have absolutely no excuse to be sad.
You don't need an excuse, man. You're a human being. You're not alone, Mr. Dietrich.
Okay, come with me.
It's okay, bye.
Dr. Troy,
What's going on?
looks like the early stages of respiratory failure. Lay him down here.
Any medical history? He was born with bad kidneys. They see him at the hospital in Gary, but I don't think they know what they're doing.
Daddy, my tummy hurts.
When was the last time he was dialyzed?
I don't know. My ex deals with that.
Let's put him on oxygen, then let Reno know he needs dialysis.
It really hurts.
I'm so sorry.
Ben?
I'm sorry.
I'm gonna give you something to make you feel better in just a minute, okay?
Here.
He's got a lot of fluid in his lungs. Hopefully the dialysis will bring it down, then we can discuss what to do next.
Yeah, of course, man. Whatever you say.
Dr. Choi?
Hold on 1 second, Maggie. I know this isn't easy, but try to stay calm. We're gonna take good care of your son.
Dr. Choi, I need to talk to you right now. April?
Yeah.
That dad, Chris Davis, there's a bolo out for his arrest.
Be on the lookout?
Yeah. He kidnapped his son.
Apparently, he just got out of Joliet on parole. Showed up at his ex-wife's, grabs his son, and takes off. How's the boy?
End-stage renal disease.
Oh, the poor kid. I'll call PD.
Wait, Miss Goodwin, Ben's in bad enough shape without having to watch his dad get arrested and taken away. Could we just hold off until he's stabilized?
April,
He risked his freedom to bring Ben here. He's not gonna leave.
I'm not sure that's our call. Can you think of any medical reason why we should hold off?
No. I'll keep an eye on Ben. Go ahead and make the call.
Okay, then.
Really?
Our first duty is to protect our patient.
How? By taking his dad away?
We have no idea what this man is capable of. Hey, Ben. Feeling any better?
No.
He's in SVT. Give him 4 milligrams of diltiazem over 5 minutes.
SVT? What's that?
It's an arrhythmia.
You mean his heart? I thought the problem was his kidneys.
It is, but kidney failure can lead to dysfunction in other systems.
Will dialysis fix it? I mean, he's been doing that and he's still getting worse.
We need to give it a chance before I can assess what else he might need.
You didn't have to do this.
Sorry, legally, I had to.
Hey, Benny. Benny, I gotta go away for a little while. But Dr. Choi is gonna take good care of you, okay? So you listen to him and do whatever he says. And I promise, everything's gonna be okay. Okay?
Okay.
I love you.
Christopher Davis, you're under arrest for aggravated kidnapping, endangerment of a child, violation of an order of protection, and violation of parole.
Do everything you can for Ben. Please.
All right, let's go.
Burgess, stop.
Hold up. What's up?
His son's really sick. Could you keep him here till we have a better idea what's going on?
That's not up to me.
I know.
If you want, I can, I don't know, call the state's attorney and find out.
I'd appreciate it. You can wait in there.
Okay. Talbert.
Thanks.
What did the state's attorney say about that kid's dad?
Haven't heard back yet.
But does he have to wait in my treatment room?
For now, yes, Ben needs a kidney transplant. I want to see if Chris is a match.
The man's going to jail.
And his son is dying. His boy needs a kidney. We don't have a choice. Almost done.
Yeah, my ex is always telling me how they're doing just fine without me. And I saw him lying there, looking so sick.
For whatever it's worth, Ben may very well have died if you hadn't brought him here today.
Anyway, it's not like he's gonna miss me. Never really been there for him in the first place.
I'll have the results soon.
What's going on?
Mr. Davis is a transplant match for our son. We're taking him up to the OR.
No. We can't do that.
Excuse me?
He's the only donor within 500 miles. Ben needs his kidney.
I'm sorry, but I have my orders.
You cannot deny that boy a transplant.
I don't want to. But the moment we take his father upstairs, he becomes our patient as well.
I understand transplant protocol.
So then you know that the dad is gonna spend a few days in the ICU, but then what? Jail while awaiting trial? And then prison? Those are hardly ideal conditions in which to recover from major surgery. We could very well lose him. Find an acceptable donor. Let's not lose anybody.
When we don't have time. And the father is a match.
You know the hospital's position on ultra-high-risk patients, especially those who have a proven history of making extremely poor decisions.
So you're sacrificing a child to protect your statistics?
Our statistics, which allow us to remain an accredited transplant center serving this entire city. And that is my concern. And it should be yours as well.
I let him know he won't be allowed to give Ben his kidney.
Any luck finding another donor?
No. I have a calling to East Mercy. There's a chance they may agree to let Chris donate there.
Let's hope.
Yeah.
The state's attorney said we can't keep him here any longer.
But we're still waiting to hear back from East Mercy.
There's nothing I can do.
Dr. Troy! He's an unstable SVT at 240.
He's not perfusing. 2 milligrams of adenosine.
Adenosine's in.
What's happening? No, will someone tell me what's happening?
Let him stay.
No change. Charge of 20 in sync.
Charged.
Clear. 2 more of adenosine. Charging to 40.
Adenosine's in.
No good. Clear.
Pulse is strong, regular.
Is he gonna be okay?
His arrhythmias are getting harder to convert.
He's gonna die.
I'm sorry, Chris.
Let me see him. Come on, please, man. It's my son.
Let him.
Oh, stop.
Not like that.
Daddy?
You're gonna be okay. I love you, babe.
I love you too.
Chris?
Do the transplant. You want to do everything you can for him? Take my kidney.
I'm trying to find another hospital to do the surgery. I just need a little more time.
No, he doesn't have time. Do it now! Do it now!
Stand down. Thought you'd like to know. We just heard from East Mercy. They would have done the transplant.
What did we do?
You are a physician, Dr. Lanik. You know that when you make a decision, you don't always get the outcome that you want. But that doesn't mean that the decision was wrong.
Ava! Hello.
Hello, Dr. Jeffrey.
Yeah. How great to see you.
Your trip was all right?
Well, as all right as an 18-hour flight can possibly be.
You already know Dr. Latham. This is Dr. Rhodes, another CT fellow.
Ah, great.
Dr. Jaffrey is not only one of the world's greatest heart surgeons, but was also my mentor in Cape Town. Taught me everything I know.
I have read your book, Dr. Jaffrey. It's an honor to meet you.
Oh, please. I'm just another patient today.
There's a tumor on the upper lobe of Dr. Jaffrey's right lung.
It's invaded his superior vena cava, obstructing blood flow to his head and upper extremities.
We'll need to remove a portion of the lung and resect the tumor.
And I want my star pupil to oversee the procedure.
Thank you for your confidence, Dr. Jaffrey. Yeah. We're getting an OR prepped as we speak.
Just one thing. I don't tolerate anesthesia well.
Well, we can talk to the anesthesiologist about adjusting your cocktail.
No. I think I have a better idea. You place a higher epidural and load me up with bupivacaine.
Hold on, you would like to be awake for the surgery?
Well, strictly as an observer, of course.
No, it's just that we would be taking an unnecessary risk. The epidural site could hemorrhage from the blood thinners alone. You could be paralyzed.
Not if we do it off pump.
Right. We can construct a temporary graft from the brachiocephalic vein to the right atrium, clamp the superior vena cava, and remove the tumor.
Certainly eliminate the need for a bypass.
Exactly.
Absolutely. We'll do it. That is, of course, if it's okay with Dr. Latham.
Good. I think Dr. Jaffrey has alleviated my concerns. I'll make the arrangements.
Thank you.
I'll let Forsman know about the high epidural.
Did we really just agree to allow a patient to be fully awake while we perform open heart surgery?
Dr. Jaffrey is well aware of the risks and has given us his consent.
There is no way that we can guarantee we'll neutralize all of his pain, and even if we do, every time his lungs inflate, it'll obstruct our field.
I have faith in our anesthesiologists and Dr. Becker.
Awake surgery is extremely risky and should only be performed when medically necessary.
I understand your concern, Dr. Rhodes. But I trust Dr. Jaffrey's judgment and respect his desire to observe. If I were in his situation, I certainly would see my own beating heart.
Some pressure.
Yeah, I can believe that.
My ventricles, contractions still look strong. No fatty deposits. My coronary artery is pristine.
Very healthy heart, Dr. Jaffrey.
You eat a lot of oatmeal, Dr. Jaffrey?
Good one.
I'm ready for the scalpel.
What? Why a scalpel?
I need to divide the azygous vein.
But shouldn't you do the entire dissection first? Save that to last.
She's got a good angle on it now.
Yeah, but what happens if something goes wrong? I mean, good Lord, you won't have enough collateral blood flow to bypass the obstruction.
Dr. Jaffrey, I want to remind you that you're awake to observe this operation, not conduct it.
Oh, sorry. Force of habit. Please proceed, Dr. Becker. Well, surely you don't intend to use a quartering knife.
I thought it would help to...
It'll help her keep ahead of the bleeding while she cuts.
No. You do not touch me with that torture device. Did I fail to teach you proper surgical technique?
You always said it's important to maintain hemostasis.
Yes, after the cutting and the tying of the vessels individually, not charring them with a bloody cautery knife.
There's a lot of cooks in this kitchen.
Yes, well, my well-being's at stake here.
I understand, Dr. Jaffrey. I'm fine. Give me the meds. There. I've got everything. I'm ready to reconstruct the vena cava. Give me a 20mm Dacron graft and a 3/0 proline stitch.
No. 3/0 is far too heavy for a graft this size.
I thought the 3/0 was appropriate.
No. All right, that's it. You're out.
That's enough, Dr. Jaffrey.
It's my heart, and I'll tell you when it's enough. Rhodes. You're in. Take the instruments. Now.
Dr. Latham, I believe that it's time to put our esteemed patient under general anesthesia.
What? No.
I think it's in his best interest.
Look, wait a minute. We had an agreement. Come on.
Alan, if you would please.
No. Alan, you do not. You wouldn't dare.
What? No. How about that? So quiet you can hear a heartbeat. Now, Dr. Becker, I believe you were about to sew in the graft with a 3/0 stitch?
Suture and DeBakey's? We were able to completely remove the tumor and reconstruct the superior vena cava.
Dr. Jaffrey?
You disappoint me.
Dr. Jaffrey, everything went perfectly. All according to Dr. Becker's plan. You were right to put your trust in her. She is a first-rate surgeon.
Get some rest, Dr. Jaffrey. I'll be back to check on you soon. Connor. I have to go put in my surgical notes.
Dr. Choi?
Jessica Pope. She was found by fire with a bag over her head. Resuscitated at the scene in a coma ever since.
Attempted suicide.
Or murder. PD's investigating. The thing is, her bone marrow biopsy just came back. No stem cells, nothing. Looks like it was blasted by chemo.
Cancer patient. Might explain suicide. Let me know if anything changes.
You got it.
How is she?
The same. It turns out she was on chemo. What do you guys know about her?
Not a lot at this time.
That's all that was salvaged from the scene.
It's her personal belongings, a couple books, receipts. We processed them, didn't find anything useful.
Hey, Daniel, why don't you take a look at this?
You never know what you might find. A lot of receipts, organized. Get ready for tax season.
Guys, forensics just came in. They only found her prints at the scene. There's no signs of foul play. All the evidence is pointing to suicide.
No change in her labs yet. Let's run another test in 4 hours.
Dr. Choi,
Yeah.
I heard about the bone marrow depletion. It's the focus of my research. There are so many discrete causes and variations. I thought we could run a few extra tests to rule out any possible.
Whatever you think, Reese. Titrate her nor-epi to keep her map at 60. We'll need to up the rate on her vent.
I'm not convinced.
About what?
Jessica Pope had a confirmation for a round-trip ticket from Paris 6 months from now. Okay, presumably when she's in remission. A conservative, responsible person with cancer, they doesn't do that unless they have high hopes, right? So she's sick, but she thinks she's getting better. Why did she kill herself? Something's hinky.
Hinky? Did you just say hinky?
No, but humor me. You know, women almost always leave suicide notes. Where's the note?
Well, maybe it was destroyed in the fire.
Or maybe it wasn't a suicide.
Have you been binging on Mannix again?
You don't like it? Stop sending me box sets for Christmas.
All right, okay. Next year will be Sanford and Son.
Dr. Halstead, do you think that your policeman brother might do you a little favor?
Turned over some rocks on the Jessica Pope case like you asked me to.
And?
I had the documents lab restore some papers from her place. And I found this.
Thank you.
Dr. Charles.
Suicide note?
But she didn't do it because she was sick.
My fault because I trusted him. I'm a fool. I can't live with his betrayal.
Maybe a lover?
Is this the whole thing?
That's all they could restore.
What's going on? Jessica Pope. Suicide after all.
Really? Because I just got some very weird test results. They confirm she's dying from an overdose of chemo.
What's weird about that?
The results also show that she never had cancer.
Just a very weird case, you know? Turns out Jessica Pope did try and commit suicide, but that's not what's killing her. It's an overdose of chemo for a cancer she does not have.
She was misdiagnosed?
And overtreated.
Someone needs to have their license taken away.
Yeah. At the very least.
You wanted to see me?
Yes, come in. The patient that was hit by a car.
Yeah, Danny Frank.
I'd like to expedite the autopsy.
Everything I did was by the book. She was non-responsive, and until I could rule out a bleed...
Not questioning your performance for a second. Dr. Choi's patient, Jessica Pope, she's dying from an overdose of chemo.
And we know Danny had a chemo port.
And she seized before she was hit by the car. Could indicate an overdose.
Dr. Charles wants to make sure these two cases aren't related.
Okay. Yeah, I'll get pathology on it.
We need to intubate.
Copy. Scope.
She's biting down. Give me 20 of etomidate, 100 of rocuronium.
Copy.
She's dropping.
20 of etomidate.
Come on.
100 of rocuronium. O2 down to 87.
Got it.
O2 down to 84. 83.
Give me some cricoid pressure.
Can you see the cords?
Uh-huh. I'm in.
81. 84. 88. 91. 97. 100.
She's stable. Take over bagging, hook her up on a vent. Excuse me.
Dr. Halstead tells me that your chemo patient, despite your continuing efforts, continues to decline.
Carol Shepard, yes.
Dr. Choi has a patient in similar circumstances, though it turns out that she never had cancer at all.
You know, now that you mention it, Carol has oral cancer, but I've never been able to find a tumor. I thought maybe it had cleared.
I think it'd be a good idea to run some biomarkers. Just confirm she had cancer in the first place.
You think there might be a connection between Ethan's patient and mine?
Hope not. Gentlemen.
Dr. Charles. Danny OD'd on chemo. That explains why she seized in the street.
Yeah, it's not the troubling part. Yeah, she was loaded up on chemo. But this woman never had cancer. Two patients in one day overdose on chemo, and neither had cancer.
Which, I must admit, does seem suspicious.
Well, it could be a new oncologist in town making incorrect diagnoses.
Or even just mixing up a few charts.
Yeah, but even then, like, why the overdoses? And on the same day?
What do we know about these women?
Jessica's note said she felt betrayed.
And Danny's girlfriend said Danny was upset about something, but wouldn't talk about it.
Something was going on with both of these women.
Yeah, but we don't have any medical records, no information that might link them. I'm gonna get in touch with some local oncologists, see if there've been any problems with their chemo or if they've had other patients in the same condition. Thank you.
Sure.
Natalie.
Yeah.
Carol Shepard's biomarkers just came back. She never had cancer.
You're sure? So she is just like Ethan's patient.
And Dr. Rhodes' patient, Danny. That's 3 today.
Oh my God.
3 women, all cancer-free, overdosed on chemo. Somebody's doing this on purpose.
Do you think a doctor's doing this? Giving false diagnoses and overdosing?
I do.
It's a long way from do no harm. I've called the police. They're on their way.